Thank you, Mr. Chairman, and the full committee for your participation, allowing us this opportunity. And I appreciate the opportunity to speak about H.R. 4212, which is the Community-Based Independence for Seniors Act of 2015, which I introduced with our colleague, Representative Linda Sanchez. The bill would authorize community-based institutional special needs plan demonstration program to provide home and community-based long-term services and supports to low-income Medicare beneficiaries who need assistance with at least 2 activities of daily living. Under current law, Medicare does not typically provide coverage for community-based long-term care services and supports, which include medical and personal care, such as assistance with bathing or managing medications. And one study found that 13% of seniors spent down their savings in order to qualify for Medicaid. The demonstration program is designed to eliminate the need for Medicare beneficiaries who receive a low-income subsidy to spend their savings and become dependent on Medicaid. Many seniors prefer to remain in their homes. In fact, they're more healthy as a result of it, to receive the care that they need, and home and community-based care holds the promise of keeping seniors healthy and avoiding costly care. The demonstration offers up to 5 Medicare Advantage plans to provide coverage for long-term care services. The plans will receive a per member per month payment not to exceed $400 for providing these services. And eligible Medicare beneficiaries with CBI SNP in their area have the option to enroll in the plan. HHS will evaluate whether providing home and community-based services to Medicare beneficiaries reduces state and federal government health care spending through delaying Medicaid eligibility for low-income seniors and reducing the need for acute care. The demand for long-term care services and supports will continue to increase. The population of seniors 85 years and older is estimated to more than triple by 2050. And this group is 4 times more likely to use long-term services and supports compared to seniors aged 65 to 84. This program is one step towards reforming long-term service and supports that can generate savings while allowing seniors to remain healthy at home. A similar version of my legislation was reported out of the Senate Finance Committee last year, and I asked for the chairman's support in advance of H.R. 4212. I also want to highlight the arbitrary and capricious manner in which CMS is making decisions regarding eligibility to participate in Medicare programs as a hospital. CMS must not establish or change a substantive legal standard governing the eligibility of organizations to furnish services or benefits unless the agency uses notice and comment rulemaking. However, CMS has done just that in a ruling that will make a determination that Wills Eye Hospital is not eligible to participate in Medicare as a hospital. In contrast, the Pennsylvania Department of Health in the state of Pennsylvania, the survey agency determined that the hospital satisfied the Medicare conditions of participation and should be licensed under Pennsylvania law as an inpatient hospital. And I asked the chairman to work with me to ensure that CMS is using known standards in making determinations regarding hospital status for purposes of the Medicare reimbursement. And lastly, I want to note with Ranking Member McDermott, I am working with him on the Beneficiary Enrollment Notification and Eligibility Simplification Act, also known as the Bennies Act. And as many of you know, Medicare enrollment rules are complex, and seniors do not receive notice from CMS regarding their responsibility to enroll. And because of these confusing rules, seniors may find themselves subject to a late enrollment penalty. The Part B late enrollment penalty permanently increases a beneficiary's premium by 10% for every 12-month period the beneficiary could have had Part B coverage but did not. Others are paying for private coverage that is a secondary coverage to Medicare, but without enrolling in Medicare, these seniors will find themselves responsible for significant out-of-pocket costs. One part of the solution is to require CMS, in cooperation with the Social Security Administration and the IRS, to issue notifications to individuals approaching eligibility about the enrollment rules and the coordination of Medicare coverage with other health insurance coverage. I appreciate the consideration of my colleagues, and I thank you, Mr. Chairman.
Thank you, Mr.